Welcome to ARFID Insights. ARFID Insights is a question and answer video series by Felix Economakis and myself, Glenn Robertson. This series will provide insight into the most frequently asked questions about the ARFID eating disorder. Okay, so what is the difference between picky eating or fussy eating and ARFID? ARFID is a relatively new eating disorder, so how can someone tell the difference? Well, fussy eating or picky eating is normal. Many children go through this phase, and that's typically what it is, a phase. They will grow out of it. Picky eating is where a child regularly refuses to eat new foods and may even be unwilling to eat familiar food. They may have strong food preferences and choose to eat the same foods over and over. However, if the fussy eater actually wanted to eat a particular food, they could. They could even be bribed to eat the food. But this is not the case for the ARFID child. Even if the ARFID child wanted to eat a food outside of their safe range of foods, they just couldn't. Their mind and body won't let them. And no amount of bribery can make them eat the food. The ARFID person might show signs of fear, anxiety and nerves when approaching their non-safe food. In younger years this may present as tantrums, and in later years it turns into avoidance and disinterest. ARFID is an eating disorder, and it is unlikely to rectify itself unless treated professionally.
Okay, so what are the most common indicators that someone might have ARFID? What can we look for to give an indication that someone is battling the ARFID eating disorder? Well, firstly, ARFID is more than picky eating. There's a genuine fear or persistent levels of avoidance around certain foods, and it rarely gets better. The ARFID person's behavior around food will continue while the picky eater generally grows out of their behavior. And secondly, as we've just said, no amount of bribing will make the matter better. Whether it's a new iPhone or a trip to Disneyland will not be sufficient to change their behavior. Thirdly, diet. The ARFID person's diet is typically what we might call a toddler diet or a beige diet. It generally consists of food like crisps and French fries and chicken nuggets, white bread, plain pasta, sweet biscuits, etc. So it's usually high carbs, high sugar, high fat, lacking fruits, veg and protein. A fourth indicator highlights the dangerous aspect of the eating disorder. The ARFID person will starve rather than eat a non-safe food. That old adage of leave them when they get hungry enough, they'll eat does not apply to the ARFID person. Many young ARFID children require feeding through nasal gastric food lines. These children are not starving themselves, rather their mind is just not allowing their body to eat. And finally, there is avoiding behavior. Avoiding things like school camps, parties, social settings, relationships, work functions, etc. Food makes the ARFID person uncomfortable, and they don't want to embarrass themselves by getting asked questions about their food habits or being nervous around food, so they avoid or miss out on things because of food.
Thank you for watching ARFID Insights. If you require any additional information on ARFID or the therapy options available, please contact Felix Economakis or Glenn Robertson.